My name is James Shanks. I am the Emerald Laser Director here for Erchonia Corporation, and today I'm going to be showing you a demonstration of the Emerald Laser System in a clinical setting and office environment. So as you can see from the system that I have right here in front of me, the system stands roughly about 4 feet tall and extends out another 3 to 3.5 feet over a table. So in your current facilities, if you have a massage table or clinical or medical table, you'll be applicable for that type of setting. So I get lots of questions on what size room would this fit in. Typically an 8x8, 8x10 room would be sufficient. It is mobile to an extent. System weighs roughly about 120 pounds, but it is manufactured to be on wheels, so you can move it nice and easily up and down the table, or if you need to switch it from room to room. So as you can see the device here, what I'm going to go ahead and show you is as you turn it towards you, the system itself, that way you can get a good view of it, you have 10 laser diodes on the Emerald Laser System. You have 6 down the middle, 3 on this side here, 3 on that side, then you have 2 on each side, which will be covering the side area or flanks, or if we're treating the upper body, which I'll show you later on, we'll be treating the arms, or if you're talking about a lower body treatment, we'll be treating the exterior part of the hips or thighs. The machine does have a motorized arm, so as you can see here, there's a little switch to where you can raise the system up, so the patient can lie down on the table. And when they're ready for a treatment, all you'd have to do is just lower the system down like so until you're at the maximum distance, which is 5 inches or closer to maximize energy density. And then as you want to apply the system closer to the body on the sides, you have these levers here that you just turn to the left, and then you would just lower them to apply to the side areas, whether the flanks, the outer hips or thighs, or the arms. So you just take like so, turn to the right to tighten down, and then once you apply the system to the patient, all you'd have to do is you just come over to our touch screen here, which is very simplistic. The machine only has one treatment option, which is going to be for fat reduction. So all you have to do is just touch the screen applicator on the system, and then it just has one treatment option on there. You can press start, and once you hit start, it will illuminate the laser lights, which I'll show you here in a few minutes, and then you can walk away. So for the treatment protocols that we have set in place, we will be treating a patient for 30 minutes. So the duration will be 15 minutes on each side, 15 minutes on the front and 15 minutes on the back. So my first demonstration I'm going to show you today as I bring my patient in is going to be on the midsection, which is going to be primarily what you're going to be treating on patients, but now that we're seeing an influx of patients requesting other areas on the body, whether it's going to be the arms, bra line area, or even we're seeing an increase in the neck or chin area as well to help with fat and retraction of the skin in those areas. So what I'm going to do here is just slide the machine out of the way, and then I'm going to go ahead and bring in our patient for today and show you a demonstration of how the system would be applied. So I'm going to go ahead and bring in our patient and have them lie down on the table. They'll be lying on their back to start, face up. And typically in an office setting, you want the patients either coming in a bathing suit or undergarments. The most skin exposure is preferred. That way we can maximize energy density and results. So as you can see how easy it is, I just take the machine, bring it on in over the desired area. So first we're gonna go ahead and start here with the midsection area. So what I would do is just make sure I have enough distance here to while I lower it down. I'm not gonna be hitting other areas in the body, so I bring it down, make sure I'm within my maximum distance, which is going to be 5 inches or closer. And always make sure when you're aligning the system that you come here and just lock in the wheels, and that way the system doesn't move on you. So once you do that, you just come in here to the outer flank area, just loosen up the levers as I showed you previously, loosen them up. Then once you've got them in that maximum distance you want, like so, tighten them back up. Very simplistic. Now once I've done that, all I have to do is come over here to my touch screen, very easy. Go ahead and press start here. And then the system is operating like so. So what we'll have to do from there is I'll go ahead and bring the camera around. That way you can go ahead and see the laser system in action so you can get a real good close. Now that we've finished the front side of the midsection area for the treatment, now the patient's going to turn over and we're going to treat the back side to complete the full 30-minute duration of treatment. So what we're going to do is just have him flip over and we're going to lower the system just like we did previously and align it in the desired areas, which is going to be the mid to lower back, and then bringing in the 2 lasers on each side to cover the flank and upper hip area. So as we lower it down, again, bringing in the sides like so, loosen it up, then tighten it back up. Again, make sure you're within your maximum distance of 5 inches. Come back over here to our touch screen and illuminate the lasers for another 15-minute durations. We'll come back around. We'll go ahead and let you check the placement, showing you the 6 lasers on the center section and 2 on each side. So remember that the patient is here, lying here comfortably. They're experiencing no pain. It is a non-thermal laser system. At most, patients might experience a light tingling. So this is a 100% treatment that you can offer in your office or facility setting. Now, once you've applied the laser, what you can do as a staff member or the doctor is you can leave the room while they're comfortably laying here and receiving their treatments and attend to other things in your office. Now, again, once they're finished, there is absolutely 0 downtime to this treatment like other treatments you might be offering in your office currently. Once they're done with the laser, they can go through the rest of their day with no pain and just keep emulsifying and getting rid of that excess fat.